Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Joint Health Workers Union of Nigeria, JOHESU, suspends 7-day nationwide warning strike to give federal government the opportunity to address their demands. Nasarawa state government drives the coronavirus enlightenment campaign, reaches out to people in rural communities. And the United Kingdom considers second lockdown as country faces 50,000 new COVID-19 cases a day by mid-October. The Nigeria Center for Disease Control, NCDC, has recorded a daily count of coronavirus cases at 97 last night, a sharp decrease from 221 and 189 reported on Friday and Saturday, respectively. The cases are reported in 11 states and the Federal Capital Territory, the FCT. The highest confirmed case was in Lagos State with 46, followed by Kwara 12, Rivers 11, Adamawa State 4 also in Niger and Ogun States each, 4 in Osun as well, while 3 were recorded in Ekiti, Imo, Kaduna, Plateau State recorded 2, and the FCT 1. However, 3 new deaths were recorded, increasing the fatality toll to 1,098, while 138 patients were discharged. The recovery count rose to 48,569. Total active cases being managed stands at 7,575. A look at the COVID-19 figures from the different states shows the epi curve taking a downward trend. It also shows that the last time we recorded over 300 cases was the 24th of August, when 321 cases were confirmed. In the meantime, the NCDC says there's no scientific evidence that disinfectant tags, often known as Air Doctor, can protect people against COVID-19. It says that the composition and concentration of the active ingredients in Air Doctor is ineffective against the SARS-CoV-2, which is the virus that causes COVID-19. It continued by saying that chlorine dioxide and its products, which are contained in such tags, can lead to serious health effects, especially in children. In the meantime, while global cases is currently at 31,044,033, in Africa, the World Health Organization Africa region says the continent's figures is almost at 1.4 million confirmed cases, while the death toll is 33,754. More than 1.1 million people have recovered on the continent. South Africa still maintains the lead with 1,585 new reported cases. It has confirmed a total of over 660,000, which represents 57.93% of all the cases in the Africa region. Its case fatality ratio is at 2.41%, having recorded a death toll of 15,953. While 89.35% number of people have recovered, it has conducted more than 4 million tests since the first outbreak. However, South Africa, like other African countries, including Nigeria, are reporting fewer cases than the peak of the pandemic. For example, South Africa reported 22,694 cases between the 6th and 19th of September. But the Ministry of Health in the country says the effort so far points to the massive testing that is ongoing. The new mobile laboratories to boost the country's capacity to test for COVID-19, coupled with the over 180 testing sites and the over 320 testing units across the country. Now, the joint health sector unions, JOHESU, have resumed today after announcing the suspension of their 7-day nationwide warning strike over the weekend. The leadership of the union has asked the Assembly of Healthcare Professional Associations to return to work across all federal health institutions in the country. According to the national chairman, its next line of action would be decided in due course by an expanded National Executive Council. The union also alleges that instead of the federal government to call JOHESU for a dialogue to resolve the trade dispute, the federal government has resorted to intimidation and blackmail of its leaders using all forms of instruments and faceless organizations. It insists that it will continue to use all legitimate means to defend the rights and demands for the welfare of its members in the health sector. Now let's take you to Nasarawa State, where our correspondent Halima Gayam brings us the updates on the COVID-19 awareness campaign.
Some residents of Nasarawa State, a huge percentage of them, have lately been flouting safety protocols. The government have used enforcement. It has also embarked on several awareness campaigns, but all to no avail. With this new behavior, the government has another strategy. Here is the Deputy Governor, who also doubles as the chairman of the State COVID-19 Task Force.
Nasarawa State is the first state that has created so many subcommittees, all in the aim of increasing awareness and getting the people educated. We have already constituted our task force committee of traditional council, and that was inaugurated about 2 weeks ago. And we also liaised with the House of Assembly to also constitute an ad hoc committee on COVID-19. We've also requested the Jamaat al-Nasr Islam, JNI, and Khan to also form committees on COVID-19. All these are a drive towards creating awareness and sensitizing the people. And we'll also have subcommittees working in all the local governments and also taking it right down to the wards and to households. We've acquired public address systems that are used now and involving town criers that are going around the states to further educate the people and let them know that COVID-19 pandemic is real. And also educating them on the necessary precautions they need to take. And that will continue to do, and hopefully we'll get there.
The government is hoping that with the new approach to slow the spread of the virus in the state, adherence level would improve in the coming days. Halima Gayam for COVID-19 Update.
The chairman of the Adamawa State Primary Healthcare Development Agency has commended the personnel of the agency for their role in the containment of COVID-19 in the state. The chairman, who is also a member of the Adamawa State COVID-19 Containment Committee, made the commendation during an exclusive interview with Channels Television in Yola, the state capital. According to him, staff of the agencies played prominent roles in risk communication through awareness creation in various health centers located in communities across the state. The Cross River State government has kicked against stigmatization of those with COVID-19 cases, saying that it discourages people to present themselves for testing. Speaking in Yako and Abi local government areas of the state, the Commissioner for Health stressed on the need for community leaders to get involved in the fight against COVID-19, to get the right information about their health and ways to prevent the disease and preventable death.
So basically, the Cross River State government is continuing the sensitization of people on COVID-19 and the reason why they should protect themselves. But beyond this, we are going into full-blown community testing for COVID-19. Today, we've taken several samples from Abi local government area. We've taken several samples from Yakol local government area, and we'll continue to go into villages, hinterlands, to take samples. We've been able to establish one COVID sample collection center in each local government area. And beyond that, the Cross River State government is seeing how we can get the health system to restart as we approach a flattened COVID curve in Nigeria. Several health services have suffered some kind of barrier or issues because of the COVID-19 pandemic lockdown. And indeed, it has been difficult for health workers to act without fear in their health facilities.
To talk more about ways we can flatten the COVID-19 curve, joining us via Skype from Imo State is Professor Chinyeru Kaga, National President of the Parasitology and Public Health Society of Nigeria. Thank you for joining us on the program.
Thank you very much.
First, what's your assessment of the fight against COVID-19? Are we winning the war against the pandemic?
At the moment, I think I would like to talk about our efforts, the effort of the society in winning this war, because it's a collective effort. Our society is the Parasitology and Public Health Society of Nigeria. We were established in 1973. And we're made up of a network of lecturers and researchers, health practitioners and graduate students from universities, research institutes and ministries. Our mandate is to develop training and capacity, which responds to the research and service needs in the country, and that brings in the COVID. For some time, we observed the situation in Nigeria, and then we noticed some operational challenges which needed to be addressed so that we can really flatten the curve of COVID-19 in Nigeria. Some of these operational challenges we noticed we have transmitted to the NCDC and the Federal Ministry of Health, and these include to really understand the pattern of COVID transmission at the community level. There is no doubt that we have a community transmission of COVID-19. And every day we are giving updates on the numbers positive. We are researchers. We need to understand the pattern of transmission so that we can know where to come in and block it. Another operational challenge we have noticed is improving the need to improve prompt diagnosis and isolation of cases. We are yet to identify in Nigeria the COVID-19 specific symptoms. Do we have location-specific symptoms? Are we experiencing the same symptoms Europeans and Americans are experiencing? Is there a relationship between malaria symptoms and the COVID-19 symptoms? These are questions that need to be addressed. The third operational challenge we looked at, we noticed and reported, were investments in advocacy at the community level. The television is filled with adverts on what to do to stay safe. We have text messages coming to our phones. We also have the social media with information. But at the community level, there are limited efforts and investments in advocacy, sensitization, and mobilization strategies at the community level. And this is where the transmission is ongoing. My society, the Parasitology and Public Health Society of Nigeria, decided to play a role in community mobilization and awareness campaign through flyers and posters in the local languages across the countries. We have about 600 members registered in our society, and we got our members in the different states to play roles in participating in local meetings where they spread the message of keeping safe and distributing the flyers. And then we also, because we're academics and we're researchers, we have designed a study, and we're in the field doing situational analysis on 3 prongs. We're exploring participants' opinion on overlapping symptoms and accurate recognition of the COVID-19 disease. We're looking at assessing the community management of COVID-19 and malaria. And we're exploring the key barriers, challenges, and solutions to prompt COVID-19 lab testing. We are almost through in the fields, and we will start analyzing our findings by next week. Our findings will be made available to the federal government, to the NCDC, to help flatten the curve completely, we'll know where we're going wrong and what we need to do. Thank you.
We'd like to thank you so much, Professor Chinyere Kaga, National President of Parasitology and Public Health Society for Nigeria. Thank you for joining us on the program with that update. We have more on the global response to the pandemic when we return. Please stay with us. Now, Lagos over the weekend announced further ease of restrictions on places of worship. According to the governor, churches and mosques can perform daily prayers and midweek services. In a tweet, Governor Sanwo-Olu says that we are happy about the downward trend in reported cases of COVID-19, and we urge Lagosians to continue to follow all the safety protocols. We have joining us in Lagos studio a public health physician, Dr. Japheth Olugbogi. Thank you for joining us on the program.
It's my pleasure, always.
So we've heard the latest announcement by the governor of Lagos State. First, are you happy with the announcement? Do you agree, based on scientific data, based on the daily counts that Lagos State is recording, albeit recording the highest of most of the cases that we're seeing in the last couple of days? Are we indeed seeing a downward trend in reported cases?
Well, if you go by the data that we have, yes, there's a downward trend, but the data itself is not sufficient to base our judgments, considering the fact that we are not testing enough. A lot of people are out there having the virus, but not subjecting themselves to tests. So if we could have a better data, a more reliable data, it should have been, sufficient enough to base our judgments on that. But the data we have, albeit correct from the standpoint of the NCDC, it's not reliable enough to base our judgments on, given the fact that it is not a true picture of things.
So do we proceed with the further ease of restrictions, like churches?
Well, we should have tarried a little with the further ease of the lockdown, of the total lockdown. We should have tarried to open the churches fully, to open the schools fully, to open the nightclubs fully. This is because of the fact that the airports are opened now, and who knows what might come in. We have other countries that are having a second wave of the disease, of the virus, and they have a different strain over there in some of these countries than we have here. So we can't say that for one reason or the other, we are, keeping tabs on the virus here. But what happens when we have another strain coming to the country that is different or deadlier than the strains that we have here?
But let's not forget that Lagos State is priding itself in terms of testing, having over 57 sample collection sites than other states in the country.
Yes, absolutely. Lagos State is ahead of others in terms of testing centers and capacity and also logistics and all that. But then again, if you remember about 4 weeks ago, the figures actually came down almost to a single digit. And then again, when the 57 centers were reopened again, I managed one of those centers when these 57 centers were reopened again, and people started coming in ones, in twos. The figures started going up again. If you study the trend, you would agree with me that the figures started going up again. There was a time we had 47 in the whole country, and now we are having even more in Lagos. So if people test, we would see more positive cases. We've tested almost 480,000 so far, and we have about 57,000 plus, and that's 1 in 8. If we consider testing more, we probably will get more, albeit asymptomatic cases, but there are still cases out there.
Are you confident with the capacity of the state government to monitor compliance as schools reopen and several other activities?
I am not, and that's because there usually not enough staff to do all that. There's several schools in Lagos, several schools, even in one community, in one ward of Lagos. So how many of them can we monitor? And then if we think that these schools or these churches or mosques will follow the protocols duly, I'm not sure we are getting it right. So they may not follow the protocols duly. If they can't follow the protocols, the preventive measures, the social preventive measures, yes, we can't say that, yeah, maybe we can just nip it in the bud. Let's not forget that some of the improvements that we have in terms of the burden of the disease may not be unconnected to the fact that a lot more people started wearing their masks, a lot more people started washing their hands. We can't argue that not so many people are, wearing their masks, but a number of people are wearing their masks, and that would definitely have a negative effect on the spread of the virus.
All right, we'd like to appreciate your time. Thank you so much, Dr. Jaffer Olubogi, public health physician.
Thank you for having me always.
Thank you for joining us. The UK government's chief scientific advisor is warning that the UK could see 50,000 new coronavirus cases a day by mid-October without further restrictions. Sir Patrick Vallon said that it would be expected to lead to about 200 deaths per day a month after that. The briefing at Downing Street comes as Prime Minister Boris Johnson considers introducing further measures in England.
England's Chief Medical Officer, Professor Chris Whitty, says the very high rates of transmission in the UK are concentrated in some areas, but there are high rates elsewhere. Adding that anywhere that had falling numbers of cases is now beginning to see a rise in the UK. Earlier on, British Transport Secretary Grant Sharp said the UK is at a critical juncture, though any new lockdown would have to be balanced with schools and businesses allowed to stay open so that the country could pay for the crisis. The United Kingdom already has the biggest official COVID-19 death toll in Europe and the 5th largest in the world. Meanwhile, data recently published by the World Health Organization says the number of coronavirus infections on the African continent appears to be dropping for weeks. In its reports, the WHO notes that there had been a 14% decrease in the number of confirmed cases in the African region compared to the last reporting period, and 83% of the confirmed cases on the continent have recovered. However, scientists warn that it might be too early to celebrate. They believe the true scale of the pandemic may be hidden because of inadequate testing. And a stay-at-home order has taken effect across Yangon, Myanmar's biggest city, after the country reported a record high number of new cases just weeks before its November elections. The region's more than 4 million people had less than 24 hours to prepare for the order, which came into effect at 8 a.m. Monday morning. It requires most private sector employees to work from home and government staff to work on a rotation of 2 weeks at home and 2 weeks at the office. Schools had already been closed under previous lockdown measures. And finally, the Taj Mahal in India has reopened to visitors after 6 months, the longest it has ever been shut. The entire campus was sanitized before it opened, and officials were seen wearing masks and face shields. Authorities have said there will be temperature checks at the entrance, and visitors will be asked to buy tickets digitally. The Taj Mahal will also now only allow 5,000 visitors a day. Before the pandemic, the monument drew about 70,000 people daily.
You can take a closer look at some of the COVID-19 global numbers in real time. Visit our website. It's channelstv.com. You get more updates and a better understanding of all you need to know about the coronavirus. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay safe.